My name is Amanda Alcama. I work for the Department of Human Services, and I am the Juvenile Competency Program Administrator within System of Care. And I've been working here for approximately 3 years, and prior to that I ran a youth substance abuse program for a local mental health authority in the state. I think it was important for them when the Juvenile Competency Statute was passed, May 8th, 2012, to find somebody who had some clinical experiences as well as some experiences running a program, because it was a new statute that had just been passed and it needed to be implemented across the state. So I think it was key to have not only that clinical experience, but also some experience running a program to make sure it was implemented in a manner that was efficient and where we were meeting the needs of the youth involved in that process. I have a bachelor's in social work with a minor in criminal justice, and then I have a master's in social work, and I am a licensed clinical social worker. I was at a legislative session in my bachelor's program. We had gone there for school and decided to do my internship at the Homeless Youth Resource Center, and it was at that time that I recognized I wanted to really help the youth in juvenile court and their families to make sure their needs were met, and also to ensure that, or increase the likelihood that they would not go on to the adult system. I think at that time, a lot of youth in juvenile court have a mental illness and or intellectual disability or have experienced trauma, and a lot of times that's overlooked by the behaviors. And so really trying to advocate for those youth to make sure their needs are met in a way that it increases positive outcomes for them and their families. Lots of meetings. So at the government level, there's always meetings. I think that's something that's different for me. So I used to be in the Division of Substance Abuse and Mental Health, and they don't provide a lot of direct services. They provide a lot of oversight to providers in the community who are providing those direct services. So for me, it's typically like dealing with the juvenile court and or cases where competency evaluations have been ordered, and also meeting with a youth who has been ordered for attainment services to try to see if they can attain competency. So it's trying to coordinate all those services, as well as a lot of meetings, and as well as we're trying to move forward in the Department of Human Services to kind of identify if the way we're delivering services is appropriate or not, and how can we do that for these youth involved in the juvenile competency process, because we know they're really high-risk, high-need youth, some of the most vulnerable population in juvenile court, because most frequently they have a mental disorder and an intellectual disability occurring at the same time. And so how do we really start addressing those needs, because they're not appropriate for juvenile court, and the structure in juvenile court will not provide services needed for positive outcomes, and they really don't belong there. And I think a lot of the court and other parties involved recognize that, and at a nationwide level we recognize that these youth also have rights, and when this is occurring they need to be addressed. We work with a lot of the community agencies, so the local mental health authorities who provide mental health and substance abuse treatment in our communities across the state, as well as the Division of Child and Family Services, Division of Juvenile Justice Services, as well as the Division of Substance Abuse and Mental Health, juvenile court, probation, frequently working with other treatment providers in the community, as well as a lot of directors of the divisions within the Department of Human Services to really try to determine. So I think something we've done really well in the state of Utah, besides that on a daily basis, we've really reached out to our community partners, including the judges, to really discuss our process and procedure for juvenile competency, as well as listen to their feedback and try to implement those changes as necessary. So it's really, I think, just there's several parties involved: defense attorneys, prosecutors, guardian ad litem. So it's really just trying to keep that communication on these cases open so they know where it's standing and how we can move forward. So when we have youth who's not competent, not attainable, who continues to participate in behaviors that are high risk, that put themselves and the community at risk, as well as they have high needs, there's not a direct funding source for these youth, and I think we're starting to address that with system of care. But right now it's really difficult when you have a youth who has been placed, let's say, in detention, but we need to find a less restrictive. Sometimes it's difficult just to find the right people to bring to the table. When you bring them to the table, there's an issue with funding sources and how do we get those services in place, especially for those youth who do not have the funding or are not insured. it's difficult to really access services sometimes. But once again, I think the state of Utah is looking at that and really making some great progress in addressing that issue. So right now, that's the main. We just have this gap of there. A lot of other states have something in their competency statute that identify a path that the family or the court can follow. So right now, as is appropriate, a youth cannot go into any type of custody solely based on competency, which is appropriate. And however, a lot of other states, the court can keep them in their jurisdiction, where we have to terminate jurisdiction unless there's a child welfare proceeding. To keep them, they can order them into some type of clinical staffing and or agency that will then help link the family to services in their community and or address their mental health needs. I really like working and advocating for the youth in juvenile court. It's something I've been passionate about since we started going to school. So I really like this ability to be able to advocate for youth in juvenile court and their families to meet their needs, as well as really, I think the legal process is fascinating, and I think it's really a great opportunity to advocate for their rights and also make sure, whatever's happening in court that they're aware of and they know the consequences, and that when they're pleading true to something that they really understand what that is. So again, it's just this opportunity to advocate for the youth in juvenile court and their families. I think the more experience you can have up front helps you identify where you would fit in or how you would like to pursue a career in this field. I think having more of those experiences up front through an internship or something like that really gives the opportunity to see whether it's a micro, macro, level, whatever level you're wanting to do. I think having more knowledge about the legislative process, policy, procedure, statutes, like how that process happens, more of that policy making piece, I think would be helpful for those coming into this field, because it really drives the way we deliver services in this field. And so I think it's good to have that knowledge. I would encourage anybody to go and get an MBA or an MPA to help support that, because I think it's important, especially if you're wanting to do more administrative or policy pieces within this field, to have that knowledge and education.